Deaths in Kenya remain among the highest in the region. The cracks in the country's healthcare system continue to cost lives. Delays in emergency response, understaffed facilities and shortages of critical supplies like blood and ambulances leads to the death of mothers. However, they do not only impact the immediate family, but the entire community. Emily Chebet brings us a story of a 27-year-old mother's death at birth and the impact it has left on a grieving husband and 3 little girls, a tragedy that echoes the pain of many families and the urgent call to fix a broken system.
At the foot of the Aberdare Hills, a heavy cloud lingers. The silence in this homestead is deafening. 35-year-old Samuel Mborothi from Wanjohi, Nyandarua County walks slowly to his late wife's resting place. This is his first time back here since he laid her to rest just 3 weeks ago. Fresh flowers rest gently on the mound of soil that now covers the late 27-year-old Eunice Njoki Mborothi. A devoted mother of 3 little girls, her life was cut short while giving life to her youngest on the 30th of August 2025. Eunice's life slipped away shortly after being transferred to Mama Lucy Hospital from Kayole 2 Level 4, the very facility where she had faithfully attended her clinics and where she had been booked to deliver her baby.
Tukiwa pale Kayole 2, vile huyu nasi alikuwa anasema harakisheni hiyo ambulance. Niliona wife yangu hapa hivi ameanza kutani yellow. Eunice Mama Lucy alika less than 1 hour. Ndio watu waambie ameniacha.
Samuel says the system failed him. His wife never missed a clinic. Every scan was done, and when the time came, medics at Kayole 2 Level 4 assured him they were ready for her delivery.
Kwanza nilimuuliza demu wangu umemuona aje, umempima umemuona aje? Akaniambia, kwanza aliniambia huyu ako the best. Juu ako 5-6 centimeters, na maji shatoka, kwa hivyo we can hope the best by tomorrow.
Eunice delivered a healthy baby girl, but almost immediately developed complications. Doctors had known of risks as early as her 3rd month of pregnancy, and she was monitored closely. She approached her delivery date with a clean bill of health. Yet, when the bleeding began, the hospital was unprepared.
Nikauliza nurse, what's going on? Juu niliona bed cold. Unaona? Eunice akaniuliza mtoto wangu wako wapi? Nikamwambia mtoto wako pale. Hiyo nurse nikamuuliza nini kinaendelea. Akaniambia Eunice bleed lakini nimeitisha ambulance more than 20 minutes na haijafika. Akaniambia namtengeneza, najaribu kufanya manual ndio aache kubleed. Ilikuwa amemfinya hapa hivi kwa tumbo kabisa.
The lack of ambulances, blood banks, adequate personnel, and in rural areas even basic infrastructure continue to drive up maternal and child mortality in Kenya. Professor Moses Obimbo, who leads the End Postpartum Hemorrhage Initiative, says the country is in dire need of more blood in the blood banks, noting that nearly 60% of all blood collected is used by mothers during childbirth.
Out of the 5 to 10 women that die every day, 40% of them die because there was no blood for blood transfusion. And it turns out that in this country we need about 550,000 units of blood every year. We are only able to donate about 150,000 to 200,000 at best, so we are about 30 to 40% capacity. Some data actually shows we only 16%, so it means we are in a blood crisis.
Behind every statistic is a family torn apart. Back at the homestead, the rhythm of family life here has been broken and roles scattered. Samuel's father has been forced to remain alone here as his wife, once the matriarch of the rural home, leaves for the city. Her now days consumed with caring for the children her late daughter-in-law left behind.
Nasikia moyo wangu sugu sana. Hii kazi ni kubwa, ama si Mungu wako. Si yako tu. Atatusaidia ile anataka kutusaidia.
Samuel, who does menial work at Nairobi's Marikiti market, now carries an immense responsibility. He cannot afford to hire house help, and with a newborn who never got a chance to breastfeed, he relies on formula milk. At 1,800 shillings a tin, the cost is already taking a heavy toll on him.
Hiyo msichana alienda, alikuwa na kazi yake, anasaidia nyumba na kimsee anasaidia watoto shule. Unaona? Hiyo msichana ndio anarugamia yeye nyumba. Unaona, anaenda. Alafu ukako na usitu sana. Kama watoto makitoka shule makaniambia ako wapi mamu. Alafu ninape mtoto wangu maziwa kwa nini na mama wako wapi.
Maternal deaths ripple far beyond the immediate family. Entire community are left burdened and disrupted. 2 years ago, Mary Njehia lost her only sister during childbirth. She and her husband were forced to raise the baby alongside their own 3 children. Her youngest, just a year old then, had to stop breastfeeding so Mary could care for both babies equally.
Nikimpeleka mara ya kwanza clinic. Venye nilienda clinic, unaambiwa upite hapa, nilianza kulia. Na nikauliza Mungu, kwa nini mimi? Mtoto akigonjeka, nilikuwa nalia, but hakuna mtu alikuwa anajua. Hata saa hii ndio nimeanza kuongea na ndio nikaamua kusupport Samuel. Juu watu hawajui chenye mimi napitia na hawakujua chenye mimi nilikuwa napitia.
Samuel's and Mary's stories expose a recurring loophole in Kenya's healthcare system. Delayed referrals. Too often, patients are held for too long, only to be discharged with papers claiming they left alive, even as they die minutes later at the referral hospitals. What follows is a circle of blame. Lower facilities insisting they did their part, while referral hospitals say patients arrived too late. In the end, no one takes responsibility and families are left to bury their loved ones.
Kulikuwa na manasi wengine kama 4, 5 hivi, lakini hakuna kitu wanafanya. Either they were student, juu anasaidia Eunice na anawekewa simu loudspeaker aongee. Unaona? Kwa hivyo ingekuwa wawili, huyu angekuwa wangesaidiana. Unaona?
The ratio of doctor to the patient is about 1.5 per every 1,000. The WHO recommends 44 per every 1,000. So you can imagine one doctor or one midwife or one nurse needs to see 1,000 patients. So we need to train more doctors. But as we're training them, there's a paradox. We are training doctors who are not being employed.
Alienda na miguu yake. Alafu akarudi ako kwa jeneza.
Health experts are stepping in with innovations that could make the difference between life and death for mothers in labor. Professor Bimbo and his team at the End PPH initiative have introduced a mobile blood bank system. Volunteers are tested, their blood group stored in a database, and whenever an emergency arises, they are called to the nearest facility to help save a life.
Eunice's story ends here, but it is the beginning of a bigger conversation. Postpartum hemorrhage remains the leading cause of maternal deaths in Kenya. Those championing to end PPH are clear. This should not be happening, not in Kenya, not in the 21st century. Emily Chebet, Citizen TV in Nyandarua County.